Answer the following questions. 1. What are the characteristics of endometriosis? 2. What patients are susceptible to this condition? 3. What forms of endometriosis exist? What are their common histologic features? 4. What are the symptoms of the disease? 5. What disorders are associated with the development of this disease? 6. What factors play major roles in the development of endometriosis? 7. Is the disease curable? What is the treatment? 1. What are the characteristics of endometriosis? Its defining feature is the presence of endometrium-like tissue in sites outside the uterine cavity, primarily on the pelvic peritoneum and ovaries. 2. What patients are susceptible to this condition? Endometriosis can be the result of diverse anatomical or biochemical aberrations of uterine functions. For example, endometriosis commonly develops in young women with vaginal obstruction of outflow, possibly because of large quantities of backwashed menstrual tissue that has become implanted on pelvic organs. In contrast, endometriosis can also involve mechanisms that are independent of anatomical abnormalities. For example, the incidence of endometriosis is increased in women who were exposed in utero to environmental toxins or potent estrogens. As cellular and molecular mechanisms involved in endometriosis are being uncovered, the disease is developing from a local disorder to a complex, chronic systemic disease. Endometriosis can be inherited in a polygenic manner. Its incidence in relatives of affected women is up to 7 times the incidence in women without such a family history. There is evidence of linkage to chromosomes 7 and 10, but no relevant genes in these regions appear to have yet been identified. 3. What forms of endometriosis exist? What are their common histologic features? The 3 clinically distinct forms of endometriosis are endometriotic implants on the surface of the pelvic peritoneum and ovaries, peritoneal endometriosis, ovarian cysts lined by endometrioid mucosa, endometriomas, and a complex solid mass comprised of endometriotic tissue blended with adipose and fibromuscular tissue, residing between the rectum and the vagina, retrovaginal endometriotic nodule. All 3 types may be variants of the same pathologic process, or they can be caused by different mechanisms. Their common histologic features are the presence of endometrial stromal or epithelial cells, chronic bleeding, and signs of inflammation. 4. What are the symptoms of the disease? The main clinical features are chronic pelvic pain and infertility. 5. What disorders are associated with the development of this disease? Common histologic features are the presence of endometrial stromal or epithelial cells, chronic bleeding, and signs of inflammation. These lesions can occur singly or in combination and are associated with an increased risk of infertility or chronic pelvic pain. The inflammation involved in endometriosis can stimulate nerve endings in the pelvis and thereby cause pain, impair the function of uterine tubes, decrease receptivity of the endometrium, and hinder the development of the oocyte and embryo. Endometriosis can also cause infertility by physically blocking the fallopian tubes. 6. What factors play major roles in the development of endometriosis? Hereditary predisposition, anatomical dysfunction of the uterus and exposure of the girl embryo to environmental toxins and potent estrogens are factors that increase the likelihood of endometriosis. 7. Is the disease curable? What is the treatment? No. We can only relieve the symptoms. The treatment of infertility caused by endometriosis is surgical removal of endometriotic tissue or assisted reproductive technology. whereas the usual treatment of pain is a combination of medical suppression of ovulation and surgery. Peritoneal implants are resected or vaporized by means of an electric current or laser. Ovarian endometriomas and rectovaginal endometriotic nodules, however, can be removed effectively only with the use of full dissection. Exercise 2. Complete the following sentences. 1. Endometriosis commonly develops. 2. This disease involves mechanisms. 3. There are 3 clinically distinct forms of the disease. 4. The treatment of endometriosis. 5. The major roles in the development of this condition belong to 1. Endometriosis commonly develops in young women with vaginal obstruction of outflow. 2. This disease involves mechanisms that are independent of anatomical abnormalities, mechanisms at the cellular and molecular level. 3. There are 3 clinically distinct forms of the disease: peritoneal endometriosis, endometriomas, retrovaginal endometriotic nodule. 4. The treatment of endometriosis is aimed at relieving the symptoms. 5. The major roles in the development of this condition belong to ovarian steroids, estrogen and progesterone. Exercise 3. Make up some sentences with the collocations given below. Clinical features: uterine function, vaginal obstruction of outflow, local disorder, chronic systemic disease, ovarian cysts. Solid mass, medical suppression, full dissection, deleterious effect, associated pain.